concerned about Ebola?
I'm concerned about everything, but certainly am. I think that, it's been confined right now to Africa, but it's something that has had a breakout.
That is misinformation. And that's why I went to Parliament to deal with the people like you.
Yes.
It would be most unfortunate if on one request by the Americans to set up a facility at their cost, we would refuse. We would look very inhuman.
Speaker, of course, I will take a very different trajectory. The Constitution of this country guarantees every single person the right to life and the right to equal protection of the law. And, Mr. Speaker, the responsibility to protect life and property in this country will never shift.
Government has also enhanced screening at our 26 official points of entry.
So the debate here is not about whether to set it up or not. The debate is, are we doing the right thing? Are we not?
One person is showing symptoms, and the U.S. has formed a task force to assist. The World Health Organization has already declared an outbreak in the Congo and Uganda.
Ebola cases rising. Is Kenya prepared?
Ebola virus disease is a severe, often fatal illness in humans, caused by infection with viruses of the genus Ebola virus. Over the past several decades, outbreaks have primarily been recorded in Central and West Africa, with the most persistent recurrence occurring in the region of Central Africa, particularly within the Democratic Republic of the Congo. But the question now pressing within public health and political circles in Kenya is this: is Kenya truly prepared to handle an Ebola outbreak if one were to cross its borders? In official statements, the Cabinet Secretary for Health, Aden Duale, has maintained that Kenya's preparedness framework is active and operational. He has pointed to strengthened border surveillance, emergency response teams, and national isolation protocols.
Government has also enhanced screening at our 26 official points of entry, including our international airports, land border crossings. As of yesterday, 2nd June 2026, 71,243 travelers have been screened cumulatively, including the 2,506 travelers who were screened in the last 24 hours.
Designed for viral hemorrhagic diseases, his remarks emphasize that Kenya's system is structured to detect, isolate, and respond rapidly to suspected cases in coordination with the World Health Organization.
The Laikipia Air Base Quarantine Isolation Treatment Facility is among 23 facilities that are going to be put up in 25 both high risk, very high risk, and high risk counties.
Senator for Nairobi City County, the Honorable Sifuna.
Speaker, of course, I will take a very different trajectory. The Constitution of this country guarantees every single person the right to life and the right to equal protection of the law.
In parliamentary debate, however, the issue has drawn sharp scrutiny. Some members of Parliament questioned whether strict containment measures, especially quarantine enforcement, could infringe on constitutional rights such as freedom of movement and due process. They raised concerns that emergency health directives must remain proportionate, lawful, and carefully monitored to avoid abuse under the framework of public health law. Reports also emerged of public concern in parts of central Kenya, including Nanyuki, where anxiety around Ebola preparedness measures reportedly triggered localized reactions. These accounts pointed to fears over quarantine enforcement and disruption of movement. He is saying his name is Douglas Mwangi, and he is a resident of Nanyuki. Today, we have proceeded to refuse the construction of the quarantine facility that is being built at Laikipia Air Base. It will affect us so much, reason being, the soldiers at the airbase, they normally come in contact with them daily. The kids learning in the airbase, we also come in contact with them. Eventually, if they get infected with the virus, it will affect also the residents. So they reject because they were not involved or any public participation done and asked if they are in need of the facility. At the executive level, the President has reaffirmed Kenya's commitment to regional and global cooperation in disease control. He has emphasized readiness to support international partners in outbreak response efforts when required, while strengthening domestic surveillance, laboratory systems, and emergency coordination structures.
It would be most unfortunate if on one request by the Americans to set up a facility at their cost, we would refuse. We would look very inhuman, you know? So the debate here is not about whether to set it up or not. The debate is, are we doing the right thing? Are we not?
As systems remain active and under continuous review, the question remains at the center of national and regional discussion. Is Kenya prepared?